We're here at Outline Skincare Clinic today in Droitwich to see a glycolic peel being performed. This is a superficial peel and we're actually using a glycolic peel made by NeoStrata. And I believe that we're doing a 20% glycolic acid peel today on one of our patients. And it's Jo, one of our therapists, who's actually doing the peel today. So I'll hand over to Jo.
Okay, so what I'm just actually doing, these little eye protectors, obviously it feels a lot more comfortable for the patients to have these on, although I'm not going to go around that area. I've already applied some Vaseline to the nose area. I don't know if you can see these shiny areas here around the mouth and the corners of the mouth. That skin is very delicate, so obviously I don't actually want to be putting the glycolic peel solution onto those areas. I've already measured my peel solution out and got it in my pot ready, and I'm actually just going to apply it with this very small brush, which I'm actually going to start doing now. So I've got Jackie completely covered up and her hair protected. It is a little bit of a wet procedure, particularly when we go into the peel neutralising situation. All of this has already been pre-checked to ensure that it's spraying before I get going. And I've also got my timer here. Initially I would start this peel, I would do a course of peel between 4 or 6 of them, and I would start with a 3-minute for the first 2, then I would start to actually increase it to where I get to around about the 5 minutes, and then increase actually the 30 to the 35% peel solution. So here I'm now going to start. Okay, are you okay, Jackie?
Yes, I'm fine,
okay, so you can feel me actually starting to apply it now, and I'm just going to set my timer. And I don't know if you can actually see, I'm just actually painting that on. It's a very, very fine solution. And I'm just painting it actually onto the areas of the skin. I'm doing it in quite large sweeping motions in which to actually get it covered quite quickly.
And I believe, Jo, am I right, that in the NeoStrata peel range we've got peel solutions of 20%, 35%, 50%, and I think they do a 70% as well.
They do a 70, going up to 70%, yes, Mary.
And we're starting Jackie off on a 20. Is that because she's not had any peels before?
She's not had any peels before, and equally so, you know, well, the main thing we're looking for Jackie here is actually the anti-aging properties. You know, we would actually start to increase those for you know, if we were dealing with if we were dealing with acne scarring and things like that, but we would always start off with the first one on the 20%.
And can you feel that, Jackie?
I can feel a slight tingling.
Tingling, good.
If I was to say, Jackie, on a feeling of 1 to 10, 10 being the most uncomfortable, how does that feel on your skin at the moment?
I'd say about a 3.
Good.
Lovely. So now what I've done is I've actually got all the solution on to the areas. And I do find with this, I mean, we've got another 1.5 minutes to go, but I do find if you actually kind of brush it along like that, it helps work the solution into the skin, and also it does stop particular areas becoming too over tingly, for want of a better word. So again, Jack, if we're looking for a 1 to 10, how's that feeling now?
Possibly just slightly more tingly, at a 4.
And NeoStrata peels are unbuffered, and that they have a low pH. That means they have a high quality of acid in them. So we're doing a 20% peel today, but that actually is more effective, and if you want to use the word stronger, than maybe a 40% peel in a non-buffered solution.
That's correct, Mary.
Yes. So these NeoStrata peels with glycolic acid is an alpha hydroxy acid. It's a sort of sugar cane really, and it dissolves dead skin cells and all the glue that cellular cement really that holds dead skin cells onto our skin and removes them. So am I right in saying that after 3 or 4 days, that's when the skin looks at its brightest?
It is, yeah. So, you know, patients report that it feels very hydrated, nicely plumped out, you know, and as we say, they're best given in about a course of 4 to 6 of them, about a month apart. So what I'm actually going to do now is I'm going to start neutralising the product. And it's literally done by doing this fine spray along the skin. Unfortunately, this actually is a little bit of a wet procedure, so I'm going to try and keep Jackie as dry as I can. Are you okay, Jackie?
I'm fine.
So this is just literally the neutraliser. Can you see that foaming up slightly there?
I can.
Slightly, here we are, it's a really good there across the forehead. Can you see that?
And do you keep spraying until the foaming
I do, yes.
stops?
So I'm actually working all the way around the areas. Are you okay, Jackie?
Yes, thank you.
And I'm trying to keep Jackie as dry as possible, but you know, we've got the hairnet, etc. Take a breath in for me, Jackie. I'm just going to go down your nose now. And breathe out, Jackie. Lovely.
I suppose the peel solution can sit in little crevices at the corner of the
can.
nose and that sort of thing, so it's important to...
So that hence why I've got those protected as well with Vaseline as well. But again, can you see that it's still bubbling in areas?
Yes.
And I'm going to ask Jackie again to take a deep breath in for me. I'm just going to spray down again the nose. And this can actually just feel a little bit shocking to the patient because it's A, cold, and secondly, you have got that wet syndrome over there. And I'm just going to make sure around the mouth area. So I'm just going to slightly spray across Jackie and there. And I'm looking at that now. I'm going to just go round and I'm checking the areas slightly again. And can you see here, still got a bit of foaming on the top there, but we can see by the rest of the face that that has actually stopped happening now. So again, I'm just checking the forehead. Okay, how does that feel, Jackie? Do you have any areas that still feel particularly hot?
No.
No, okay. And again, I'm just going to look at that area again now. Yes, and I'm happy now that I've got that, as that's actually now died down. So as you can see, we've got Jackie actually nice and neutralised now. And what I'm actually going to do now, these are just actually some little gauzes that I've had in the fridge, and I'm just going to actually pop them, allowing obviously Jackie still to breathe, along the areas, and this actually just gives an extra cooling effect.
And you increase the time of the peel with each session that they have, do you, Jo?
I do, yes.
And what home care products would Jackie be using?
Generally, we would actually kind of steer now to continue the benefits of the peel, kind of steer it really towards using, say, something like the NeoStrata Bionic Serum, facial serum, which is what I'm going to put on today. But the NeoStrata range will continue to help with the benefits of this peel, to keep with the hydration, etc. So in Jackie's case, because obviously, I mean, you can see here, you know, she has got lovely skin, I would probably go just more to a general anti-aging package, you know, which would include a good cleanser for her, and perhaps something like the NeoStrata Renewal Cream to use after a few days, and definitely the Ultra Smoothing cream along with the Bionic Serum to keep the hydration in the skin and actually help with the benefits of the peel that I've just performed. Does that feel okay, Jackie?
That feels lovely.
So I'm going to actually now remove the iPads because I don't need those any longer. Okay, I'm just actually going to take a couple of dry bits of gauze and actually just rub those actually on.
And is there any downtime with this peel, Jo? Do people peel, or can they go back to work?
You can go straight back to work. You know, if you are going back to work, we can always actually just pop a little bit of mineral makeup on, something like Glow Mineral Makeup, or alternatively, you know, if the patient is going home, quite often they're just actually happy with the products that we put on. This is the NeoStrata Bionic Face Serum, which again is very hydrating. And patients might actually report that they might have a little bit of redness or a little bit of flaky skin, but generally we'll turn around and say that their skin feels nice and hydrated from the minute really that they walk out the clinic. So I'm going to be popping a good amount of moisture actually on Jackie's skin now, and this will help. Really, this will actually, you know, help with any like flakiness that she'll have, so she'll keep her nice and hydrated. But generally, no, you can go back to work. She could go back to work now, as you can see. She's not over red or anything like that.
And are you finishing off with a sun cream?
Yeah, so obviously with any peel that we do, anything at all, we all know the importance of using an SPF protection anyway, but now I'll be applying an SPF 50 to Jackie's skin, and that's because I just really want to provide her with that extra protection before I simply send her out of the clinic and allow her to go home.
Lovely, thank you. So that is a NeoStrata 20% glycolic peel performed at Outline Skincare Clinic in Droitwich.